There really isn't anything that's being offered to any patient anywhere that we don't have and that we don't do well. What differentiates our programs from others is the depth of experience of the operators. We have an incredible team in the mitral program. Many Americans have leaky valves or they have valves that are blocked. The mitral valve is a very interesting valve. It's almost like a parachute. It opens and it closes. In many patients, there's mitral valve prolapse where the leaflets don't meet in the middle and it causes a leak. In other patients, the mitral valve is fused and it doesn't open. At Orlando Health, we have a comprehensive approach to problems of the mitral valve where all modalities are available. A lot of patients, many patients, still require an incision in the front called a sternotomy. And it's an excellent incision, and we use it in heart surgery all the time for mitral valve and other conditions. And patients recover well and they're happy, but the recovery is longer and it's more difficult. But many other patients have other options. The least invasive involve putting a clip in the heart without an incision of any kind. And the clip can bring the leaflets together and secure them so that they're not moving in an abnormal way. We can also operate through a minimally invasive approach through a little 2-inch incision in the side, using specialized instruments, cameras, light sources, so that we can see inside the heart and we can repair defects in the valve and make the valve work again the way it should naturally. Going through a little incision, the patient is up out of bed quicker, they're home faster, they're back to work faster. This is a great incision. This is an A. This is an A+. Now, not all patients can have that, but in our practice, almost 80% of patients, which is a very high percentage, can have a minimally invasive approach. Why doesn't everyone do a minimally invasive approach? It's harder. It takes a level of expertise and training that most people don't have. It takes years of experience, and it takes a dedicated heart team to know which patients benefit and which patients should have another approach. The most important thing about mitral surgery is really the experience and the expertise of the operators, that their surgeon or their interventional cardiologist or that their team has a huge experience and has a track record of good results. As a matter of fact, the images that we get of the valve now are incredible. It's almost like being inside the heart and looking at the valve directly. We have surgeons who are facile with both minimally invasive and traditional techniques. We have experienced people who have dedicated decades of their life, their training, to perfecting and refining and advancing the science and the treatment of mitral valve problems. The push of our program and of our operators over the past 20 years is to seek more and more minimally invasive techniques. If you think about the benefits of minimally invasive surgery, all you have to do is talk to one of the patients. They have a little incision in their side, they leave the hospital, they feel well, and within a week or two, they're really back to normal activity. One of my patients was actually a classmate of my daughter's in high school, and she had a condition, a floppy prolapsing mitral valve, where the leaflets didn't meet in the middle. She had spent years as an adolescent and as a young woman concerned about having a big scar, and we were able to fix the problem and get a great result through a scar that she can't even see now. And she feels better, and it's all in the rearview mirror. What we want to do is we want to do the same thing through a little incision that 20 years ago we had to do through a big incision. No compromises, a perfect repair through a minimally invasive approach. This is for the patient's benefit. It's harder for us, it's a lot easier for them.